Good morning, everyone, and many thanks to the Forum for this invitation and opportunity to speak a bit about patient perspectives on mobile health and particularly health apps. A bit of background on the organisation I'm involved with, Patient View. We've been collecting and analysing patient perspectives on a wide range of healthcare issues for the past 15 years. We now have the capacity to reach out to about 120,000 patient groups worldwide, covering about 1,000 different health specialty areas. From the interactions we've had with the patient groups over this time, a few years ago we were getting lots of questions and feedback about apps from the patient perspective, which ones they could trust, because at that time there were about 70,000 health apps. It's now estimated to be about 150,000, but actually nobody really knows. And how do you find the ones that work for you? So with a variety of partners, multi-stakeholder partners, we set up this web portal, myhealthapps.net, in November of last year, which aims to be an information resource, an independent information resource for patients or consumers or the general public, carers, to try and find apps that might work for them. And these are ones that have been tried and recommended by patient groups. So we put up the information and the reviews from the patient groups, and we provide as much information as we can about the app, who funded it, whether there was a medical advisor, whether it's had regulatory approval, all this kind of thing, which patients were reporting back to us. They were finding it very difficult to trust, to know which apps were any good and to know which ones to trust. So this is part of the process of what we do. The other areas we've been looking into, and we've been surveying patient groups for the last couple of years about what they want from apps. And part of what we did with that originally was so we could come up with a rating system based on what they wanted from apps, which we used in the website. But the recent survey we did, which we carried out with Health 2.0 in November of last year, well, we published it in November of last year, was what they are wanting now from apps that they're not finding. Because one of the key areas, of course, is unmet need. So we have published the results of that, and you can find that on our website, and I've put some information up on the side there. And what we're finding is that apps, most people are still using apps by themselves for the wellness, fitness things, all the things that we're encouraged to do for self-care and to maintain our own health, because as we all know, we're going to have to do far more of it. Healthcare systems can't cope with that. But they now increasingly want to move into integrating with their healthcare providers and their healthcare systems. And this is what we're seeing more and more of with the new kinds of apps that are coming out, that the integration is going to be far better in terms of sharing data with your clinician, or it could be your carer, or it could be your social care system, but with the patient controlling that data. And that's coming out very strongly, that is where they want it to be and how they want it to work. So we're running a couple of projects at the moment with various GP practices, where we're asking them to try apps on our site, or for example NHS England's Health Apps Library, and to report back, because we need more feedback. I mean, we need more data on what patients really want from this, because if it's going to work and be integrated and in the way that everybody wants it to develop from an industry perspective, healthcare professionals or whoever, we really need to have the patient user experience included in there. So that's basically it. I think I'll leave it there at that point, but I'm happy to take any questions later. Thank you very much.